New at 5, a new recommendation has been made calling for anxiety screenings to be added in primary care for adults under 65 without any symptoms.
Houston's only full-time TV health reporter, Haley Hernandez, is joining us now with more on the recommendation and how it will play out. Haley, right now there isn't really a plan in place for this, we understand.
That's absolutely right, but this is a recommendation that's really long overdue. The average age of being diagnosed with anxiety is decades after the symptoms start. Hopefully this identifies those suffering much earlier. The problem is there is no follow-up plan to get care here in Texas.
According to the latest recommendation by the U.S. Preventative Services Task Force, routine screenings are considered beneficial for adults under 65, including pregnant and postpartum women without any symptoms.
Postpartum mental illness is actually associated with maternal death.
Anxiety disorders are considered the most common mental illness in the country, affecting nearly 50 million people. And that's based on data taken before the pandemic. Today, Dr. Asim Shah, professor and executive vice chair at Baylor College of Medicine, says it is much worse.
Pandemic anxiety and panic and phobia increased at least 30% more than before. That is the reason we want primary care doctors to be aware of at least basic treatment of anxiety and depression. That way, at least a lot of these patients can get help at the doorstep.
The reality is there's no plan to implement it. I spoke to the Department of State Health Services today, and they say they will have no part in screening and follow-up treatment. Instead, it will be up to individual doctors.
Easy to say, do this and do that. Do they have time to do that? And even if they do it, even if they carve out the time to do it, where would they refer the patient?
Unfortunately, seeking your own therapy sheds light on a different issue. There's a shortage of mental health professionals right now and often long wait times to see someone. Dr. Shah says if you have mild symptoms, it's okay to use mental health apps like Talkspace, BetterHelp, or Teladoc. Check with your company to see if they have an employee assistance program, which may help cover some costs.
Don't treat your anxiety yourself. Go and see a qualified physician and get help. Anxiety can also be treated by psychotherapy, by cognitive behavioral health therapy. So there are many options, and it is a certainly treatable disease.
Now, the number of adults seeking treatment increased from 19% to 21% after the pandemic. Healthy ways to cope with anxiety include identifying what your triggers are. What are the situations or circumstances that increase your stress? Make sleep a priority and maintain a healthy diet. And if you find your anxiety interfering with anything in your life, seek help from a doctor and have them help you develop a treatment plan. Lauren?